We start with looming sticker shock for Arizonans who buy their health insurance on the Obamacare marketplace. When open enrollment starts in less than 2 weeks, customers will get notices of marketplace rate increases ranging from 2% to more than 55%. That's according to the Arizona Department of Insurance. Enhanced federal subsidies that have kept premiums down are set to expire at the end of the year. Democrats have been holding out to extend those subsidies, and that's at the heart of the government shutdown right now. Will Humble of the Arizona Public Health Association joins us with more information on what marketplace customers can expect. Welcome back to Square Off.
Morning, Brian. Thanks.
I want to first start with Obamacare. By the numbers, about 400,000 people in Arizona are covered by marketplace insurance. They live in red and blue districts. Democrats Greg Stanton and Yasmin Ansari and Republicans Abe Hamada and David Schweikert have the highest percentages of Obamacare enrollees here in Arizona, that according to KFF. Let's take us back to the beginning. Why did Congress pass these subsidies?
Yeah, so back in the original Affordable Care Act back in 2010, there was an advanced premium tax credit that everyone qualified for, depending on income, to help, especially the middle incomes, to make the insurance more affordable. Then, during the pandemic, there was something called an advanced premium tax credit. It was associated with the Inflation Reduction Act and the ARPA, those two laws. That made it even more affordable. So a lot more people enrolled in the Affordable Care Act in the last few years because the premiums became a lot more affordable. And as you mentioned, that enhanced advanced premium tax credit is going away at the end of the month unless Congress can negotiate some sort of
at the end of December, January 1st. And I think the enhanced credits expanded the marketplace, people on the marketplace by, I think it doubled.
Yeah, doubled the number of people that could, and by the way, it helped people to, that were in jobs they didn't like. They thought, oh, you know what? I can go out and do something on my own, start a small business, become an independent contractor, and because I can afford these premiums now, I have the freedom to be more of an entrepreneur. This is going to change that calculus.
Okay, a question from critics who say, okay, it's called the Affordable Care Act. Is it really affordable if you have to keep enhancing tax credits to make it even more affordable?
Well, that's the subsidies, the advanced premium tax credits for middle income people. It stops at 400% of poverty. So it's not like, people making $200,000-$300,000 are getting a break on their insurance, but it really helps for that middle class family, the people making between say $30,000 and $90,000 a year. Those are the folks where the advanced premium tax credits actually make it affordable. Hence the word affordable. It's even more affordable now.
The more Affordable Care Act, maybe.
That's a good way of putting it, yeah.
Are those the folks you described in those income brackets, are they most affected by these increases?
Yeah, so the folks that make, say, in the range of, say, $30,000 to $50,000 a year, if Congress doesn't fix this, they're going to see the biggest percentage increase in their premiums. But the people that are making, say, $80,000, $90,000, they'll have a smaller percentage increase in their premiums, but a bigger absolute dollar figure increase. So it's sticker shock no matter who you are in that range between the poverty level and, say, $100,000 a year. Above that, I heard Mr. Biggs say that people making $600,000 a year are getting a break. They're not. It's really limited to middle-income people that get the subsidy.
That's Republican Congressman Andy Biggs, candidate for governor, said people earning $600,000 get it free.
It's false. That's not true.
Just not true. We talk about fixes. Republicans for many years have wanted to get rid of Obamacare. They tried and failed when John McCain just did a thumbs down several years ago. It seems like any fix is going to diminish this somehow or destabilize Obamacare somehow, because it's not going to get any better, right? There are no Republican votes to make this better.
Well, we'll see. I mean, look, as you mentioned, not just in Arizona, but across the entire country, there's a lot more people in red states, percentage-wise on a per capita basis, that are on marketplace insurance plans in that dollar figure category. So I think they're going to come up with some kind of resolution, because there's a lot of these red states that are benefiting greatly from these enhanced advanced premium tax credits, and those are voters.
So you think Republicans might be feeling the pressure because I don't think there's any evidence of that just yet.
Well, there's what you see, and then there's what's behind the scenes. I don't know if there's a difference or not. I think they'll work something out.
Okay, but what about this idea that they could destabilize the marketplace with these higher prices? You have some.
Well, right.
Younger
So, I see where you're going with that. So, yeah, if they don't fix this, you're going to see a lot of enrollment. People leave. So we got 400,000 people on the marketplace in Arizona right now. That could go down to, say, 250,000, let's say.
A half.
Okay, and the people that will likely leave are the healthier people who are like, I'm going to roll the dice, man. Nothing's going to happen to me. Well, those are the cheaper people to insure, and then you're left with a worse risk pool that's more expensive. So that could potentially happen if this middle-income group, they don't get these advanced subsidies. They say, I'm out. The risk pool gets bad, which makes the premiums more expensive.
So it's like
for everybody.
It's like a double whammy.
Yeah.
Okay, you have some great consumerish advice for how
Right.
to shop for the plans once open enrollment starts November 1st.
Yeah, November 1st is when open enrollment starts. To get your insurance for January 1st, you need to finish by December 15th. I just urge people to not make that decision right away, because the price that you're going to see November 1st, if Congress doesn't fix this, may not be the price that, in other words, you might go onto the marketplace, say, I just can't afford this anymore. I can't afford my gold plan. I'm going to buy bronze because I can't afford that without this advanced premium tax credit. And then Congress fixes this, and then you're stuck with a bad plan. So I'm going on and on about this. But the bottom line is, I urge people to do your research in November, but don't make your decision until early December, because you may have a lot more information about what it's going to actually cost when this shutdown and whatever negotiations come out of this happen.
And just to be clear, because those numbers in November, when open enrollment begins, will assume the subsidies are going away.
The enhanced subsidies will be going away. I think they're going to assume that until Congress, because the law says it's ending. So that is the law. They have to change that and extend it, or fix it or not, which they might not.
But if in the interim from November 1st to December 15th, Congress does something to not make them go away, fiddle with them somehow,
Right, the website will update, and you'll have a better, you say, oh, actually, this is a better price. I'll go over the gold plan.
You might see better premiums. So keep your eye on what's happening in Washington.
It makes it hard for consumers to make a decision during open enrollment when all of this is happening during open enrollment.
All right. Will Humble, great advice. Thanks so much for joining us.
My pleasure.